Chiama Media Institute, you can impact yourself with creativity with us 80% practicals. Come one, come all. Chiama Media Institute is the best place for you to come and impact yourself with creativity. We are located at Kumasi Daba in Sendes, or you can visit our website at www.chiamamediainstitute, or you can pick a form at our front desk, or you can call 050-6183-336. 050-6183-336. Chiama Media Institute. The vision is clear.
It's a lovely afternoon, or lovely evening, on Chairman TV. My name is Jataba Omai Dububo. I'll respect all you cherished viewers of this onerous program, Citizens Vibe. Naturally, say ye can't yasem say na beya Omai Ghana every two empong. And that you share apomden ehonsem. Today we shall be looking at the state of health care in Ghana. Nti eyema Ghana apomden hospital no ndu aye no ye check yen ye handling the same because health is wealth. Say na Bible aka say wo apomden a na wo sika. If you got life, you get property. If you got life, you get everything. Sana etie nti no enne ye share the state of healthcare in Ghana. And those who which me join discussion on 0543736700. Mention be line out to I also watch wadwene bibia wo biara no. So show we me no inana our Chairman TV. I say those of when you are like a say Chairman TV, YouTube live, YouTube Chairman TV GH, and I think so Facebook so Tony Serious, Facebook, also Okohosa on Cyber Kayan Fefe, now you know Eddie Kita who DNA share, Konya Befasona or my Ghana to me afternoon to my part if I visited two kind call London and I say America and I'm not baby I attack and for said the health system is working. But why as school I could be professors, doctors, you loaded. We have a lot of them, but what are the shortcomings in the healthcare in Ghana? The body and however, and I say no main kind for you now. Charles Emisa 29 years because of no bed syndrome or you call hospitalized into general emergency service no system is it is at a very deplorable state. Intimi enye dwuma papa nti papa yi ahwe no kwa ya oyobi a ka obetumi ahwe busia oye engineer by profession now so enam say your health system no enye yi nti wahwe no kwa se be ka ya John Kuma no finance minister ono so hwe no kwa saa e wo kwan so a lot of people na ye betumi aka afa omo even younger say late Professor John Evans Atamnos the same thing ono so emergency the vice president Mr. Ataso in the late ono so the same thing Okojim, your father and I didn't pick up when you do hospital no, and I went to me and saving no quan. Nti a idea echo so na yenshe titu from po esho or mukwa because of lack of a healthcare services and as a poor attendance to our patients. Nti because of that no, edi omainya our human resource is gradually wiping away. Ebeye den the to me ama nyoma ejina na omai etumi etu empon nti na ye share President John Dramani Mahama 5 years ago bosha o share yes so ba Ghana health care no eda na koma so obesolve no but this is 1 year NDC aban ewo power as time to be corrected since so kra kaka to bi na aso anasa aso so na aboro so a wo so betimi akire wadwene ye hu say NDC aban no mo bo ho de health care mu anasa just the rhetoric e kasa nko because Dr. Grace Ayensu a deputy minister of health wakasa or say no bed syndrome no and yes say empa ni ho na kwa yes say we yare from ambulance emergency time na ye be fa no na ye be hwe say wutumi home anase muje tu a care na ye de ma on the street or at that emergency point na ye fa na ye do koni nyinara no ni na eka ho na yes say empa nko ba binim so akire o ma adwene say empa eni ho na ose enye no na nipa no wiye aside by practices bia obetwini ko for ba oba ashanti mem hanso a Ashanti Regional Commander of Ambulance Service on Sakasa, or say ambulances Nankasa no available, or say ambulances na the fact nipano that the ambulance delivery system in Ashanti region is very poor and yet it's not up to scratch. It's not just say when emergency case that's 1 year one private person and that's a private ambulance worker poor one shall be one shall be for better na what for ananum ewo ensero. That is very bad and you good as a nation say you know when yinara ye pe ye kan kono yɛpɛ sɛ bibia ɛkɔ kan ɛma yɛn no nti mbrɛ no so a wo so betumi akyerɛ wadwene minority speaker Fiona Kings no so akasa afa ho say hepatitis B yɛnhyɛ daa pay attention to it hepatitis B yɛka a yɛfɛ no kokram yare liver yare na wobɛtumi enya according to health experts no through diverse ways sweat cramp no obi sweat kan wa etumi si obi ne o ɛda kora etumi ɛma wonya na even dangerous more than HIV sana health ɛyɛ professionals ɔmo aka akyerɛ yɛn na yɛyɛ ho asɛmsɛn yɛsɛ sɛ wokɔ mpo a ɛyɛ retroviral drugs kwa ɛwɔ hɔ a yɛsɛ nkɛde ma wɔde bɔ wo ban no sɛ wonya a ɔsɛ ebi mpo ɛnni hɔ sɛ wonya saa yareɛ no a the cure of it no mpo no ɛyɛ problem na even sɛ yɛbɛma wo ɛyɛ care no so no ɛyɛ big case nnuro mpo a ɛnni hɔ na yɛka ne sɛn na yɛyie nti wo so bɛtumi so akyerɛ wadwene na me no yɛka a ɔmanpanyin obɛtie na ɔbɛyɛ also yes when in or say we should hold his feet to the fire and we should hold him accountable na yenim say eno na say ya bibia betuma ye because Obama bagana no or say we should let the systems work until no say we health personnel and ya wadwin so bet na okeke na wajiska egu botom health insurance na kasa me bisa say eye adwuma na ntimbre ni wo so betumi afre betumi edo comment afa 0543 736700 na ye bekenkan ama fefefe na konso wetumi akyerɛ wadwene na ekoda Facebook anase YouTube a wa wo betumi so akɔback na wakɔbɔ na wetie wo voice anase wo comment nti say subscribe Chairman TVGH subscribe it on YouTube na wo be hu bibia sɛ ɛda hɔ nti swiftly no yɛnsɛe emre no yɛnhwɛ ɛyɛ President John Dramani Mahama ne bɔhyɛ about healthcare in Ghana na yɛnhwɛ sɛ anyebia awehyem ewom anase are we supposed to push him to do what he has promised? If you say yato abanama no, or no first gentleman of the land. It's you say you holding accountable. Inti sama waka afa Ghana healthcare no 5 years ago up to now no birth syndrome no for itina Charles Ogura Charles yedin media bay wa hwe no kwa just about a week now aye beja woman mu primary house for akasa bebre afa ho inti president on the man no manisima afa Ghana health bosha o share yenhwe se odi so anase oye ne sen.
The advent of the COVID-19 pandemic in Ghana has also provoked quite a useful debate about the need for a more robust and effective health system. It has become obvious that the system must not only be responsive to the immediate and long-term health needs of our people, but also withstand emerging global public health challenges, such as this novel infectious disease we're facing. It has been widely acknowledged that some of the critical investments and I'm referring to the National Democratic Congress administration, in which I was vice president and later president, made in the health sector have proved extremely useful and enabled Ghana lessen the impact of this pandemic on our people and our nation. My brothers and sisters, this acknowledgement bears out the vision and clear thinking that went into the massive investments we made in the health sector. There were uninformed and snide remarks at the time, some questioning why many such health facilities were being constructed. We were acutely aware, however, that these investments were necessary to modernize a very fragile and weak healthcare system. What we had at the end of 2016 was not the optimum, but great gains had been made. And so if government had diligently continued and added a few more beds and enhanced medical equipment, our situation would have been better than it is today. The pressure on the existing health facilities and our health personnel would have been much less. We pumped in the needed resources to establish health facilities at all levels, from quaternary, tertiary, regional, and district hospitals to polyclinics, health centers, and CHIPS compounds. These had the effect of opening up the health system and making healthcare accessible to all, including unserved and underserved communities in even the remotest parts of.
That was His Excellency President John Dramani Mahama, the President of the Republic of Ghana, saying he's committed to excellent healthcare in Ghana. That's 5 years ago, and not making commitment. But while I'm president, this is 1 year. Now, so still, and for a complaining, say healthcare no poor. In fact, so far, nipa baye 10 ewa Ghana. Baye 3, the omunya good healthcare. Just a few of them. Now, one of Nkwofi Honorable Ayaraga, that's majority leader in Parliament, Boko Central MP. And also akasa afaho, or say Okonya accident be or council. Now, so Okonya of us on saying, yeah, emergency team who share more effective or one. Young journey about the poor people in the cottages and the hamlets, the villages, the smaller towns, almost how bang almost a firm. That area no nti wo so betumi afra bibia wo biara na so do agenche aba say me so dia me face e wo me clinic and say me health center no say na tie yenka na yentumi enhyehyɛ enoma no ye health care and say ya pomuden no entumi enkonkan because health is wealth so wo apomuden a na wo nkwa wo apomuden na wo ade so wo ni apomuden na kyerɛ sɛ wankasa wo nkwa no very fragile and shada awurehemu bia entumi embam. He says, "I to kanya na unya accident a ese unya emergency response team na etumi fire fast na ye de wokɔ sana ese etumi eye adwuma na bibia ye fast na etumi so enya hodin na etumi asom ye man ntie Ayaraga majority leader in Parliament asema okan ye na watwi ose ehawa ofam no se ye nyame a ntie ye meka asem wi na wo so wahunu say a serious issue. I say ye na ye tumi ejina yan fight say na be ya ye man healthcare system e betumi aye adwuma enkwala o mpanyimfo ye yi obia emfrim ahemfo nyinara. Everyone is involved in this fight for excellent healthcare in Ghana. And ye kan ho asem on Citizens Vibe Chairman TV this time no inti baby a wo bia wo so betumi adwone discussion 0543736700 making kind of comment na ma fefefe mren so a ye be line so tu na wo so a kire wadwene ntie Honorable Ayaraga say true say omo so omo face sa issues na in Parliament House of Ghana yentie.
Thank you very much, Mr. Speaker. Mr. Speaker, I speak as someone who is alive today because when I had a similar emergency, the system worked for me. I speak as that person. I had an accident somewhere in Nasia, and around 4 a.m. in the morning, Mr. Speaker, by divine occurrence, I was struggling to get to the nearest hospital because even though I had no scratch on my physical body, the impact was so great that I thought something wrong must happen inside me. A market truck, a Peugeot, old Peugeot, which the villagers used to attend market early in the mornings, was passing. It had 8 passengers, a Peugeot. I pleaded with them to open the boot so that I would sit in the boot. And indeed, they came down and they were struggling to remove the spare tire and shift the spinner so that I will sit and then my legs will hang outside because I insisted I must get to the nearest hospital. Luckily, a brand new pickup arrived there and written on it was Navrongo Medical Center. They stopped, they checked, I was the one. They mentioned my name, they recognized me. It was around 5 a.m. by that time, and asked me what was wrong. I said, accident. I want to get to the nearest hospital. So they picked me and they sped from Nasia to Tamale. By the time we arrived there, Luckily, the health personnel were all down waiting for me, because one of our colleagues, the late Alaji Limuna, was then the regional minister and had called ahead. So, Speaker, our colleague here, Dr. Anaba, was the anesthetist. They used 7 pints of blood on me that morning. 7. They performed the surgery, and apparently I had started suffering from internal bleeding from Nasia until Tamale Hospital. A journey of about 2 hours, I was bleeding internally. The doctor said if they had delayed for 30 minutes, by now, perhaps 30 minutes, the doctor said. And Dr. Naba is a colleague in this chamber. Mundaka was a colleague at that time. So, Speaker, I speak as somebody who was kept alive because the emergency ward of a hospital worked for me. And it must work for everybody, every citizen. In some jurisdictions, they would have been outraged. There would have been public outrage, not the type that I see happening. That an accident victim was moved from hospital to hospital, and the medical personnel there refused to treat it as an emergency. It says everything about us as a country. The indiscipline, the disregard for human life, the lack of fellow feeling, that we don't see that this is a fellow Ghanaian who, whatever we are doing, we must stop and attend to. Otherwise, a life will be lost. We must be outraged about a thing like this. Mr. Speaker, I believe that we must get to the bottom of matters like this. And I thank my colleague for bringing the matter up. And I think that at all times, this Parliament must hold those responsible for such conduct, to account. See, we talk about it, and then we leave it there. It happened in 2018. What happened? What did we do? How did those accountable fare at that time? This is what those who have done it today will be inspired by. They will talk, they will do nothing. We want to see action this time. We want to see people held accountable so that the rest of the health personnel across the country will know that this Parliament will not sit idly by whilst people negligently lead to the loss of life, such as what we have seen. So I thank my colleague for raising it. And Mr. Speaker, I do agree with him that even though government says we are setting up a committee to look into it, that this Parliament should be interested in what happens. And so our Committee for Health should follow up on what government is doing and then bring us a report. And if we are not satisfied with the outcome and the conclusions of government, that this Parliament takes very drastic action. It is only then that citizens will know that when we converge here for their very existence. We are here to defend their lives, to defend their rights, and to defend their interests. But Mr. Speaker, we say we should not politicize things. But permit me to say that who is responsible for the conduct of the health personnel? We, the politicians. Who is responsible for making sure that they work under environments where when there's an emergency, they will respond to it? We, the politicians. Who is responsible for making sure that there are enough beds in the hospitals? We, the politicians. So when we say we shouldn't politicize things, I agree that we shouldn't be partisan about it. But the root cause is always political.
Honorable member, who is responsible for the politician? It's the citizens. So it's the citizens. They are responsible for the politician. And so when you started by raising the issue about the outrage, that is not enough. You are right. If the citizens rise up, they should rise up and hold the politician responsible.
We are watching Citizens Vibe on Chairman TV. It is very appalling. It is very sad what the Speaker of Parliament, Alban Bagwin, the Honorable, or say who is responsible for the politicians. Definitely the citizens. That is, I and you will have to speak out. If we don't hold them responsible, meaning fire who what onumpono oye minister mpono onumpono oye former minister oye majority leader osanso ye MP no oso onya accident wa kwan so na e ka de ka no kwan efri nsa oso ye de ne ko share car boot because na the car no ntumi nante. Fortunately and an Avrongo healthcare car far around and a far no dimi tum oso onya accident far away in Nasia, that is northern region for baby. So the upper east so it's easy. Now what about the poor people on the street? Omo ye MPC ministers no omo yare a ekwan be no mofa so ese ye stage demonstration ese etu tesukoko kire aban se ye ni abere na aban eye bibi fa ho ana because mpanyimfo nyina enim nti na ma hyeda abo eye Honorable Haruna Ayarga video no. He's been a victim of it. But eye ononko yentie eye Afinyo Markins also lamenting about the state of hepatitis B in Ghana. Kokram yale eye how kese nipa yale nipa bre no education about it. Mente se obi ye cheda bohudo wuro say oh hepatitis B no say oh pese be chiwa say the way to avoid it or the way to minimize it, you know, the disease, you know, so there's no clear-cut solution to it. We are just battling with it here and there. And yes, some ketwa, yes, some ya. Nti ese me no we kasa, say hepatitis B patients both together. Now we press conference and I say mumu ba bonti na mo kasa ese mo ye. Because maybe I do know. We have to face the bull by the horn. I say yeah wild. Near kasa ho. I just say omo ya aware na eye ni da ho. E bin so a poor health care service. Ukwa nurses for ni binumu sebi o ni mini skirt to say skirt atali dress short dress o no wo so no to no nam ho ofa no kwa o yale for yale serious. O ma o but so be pack card ya obeba to attend to you. So ba o hwe wo face and sana waba. O me binum kwampo no nru ese o motoma no obeto no more than that. Obeto no more than that amount. The whole corruption in the health sector. Easy. Ti nipa ba embre, nipa ebre. Nipa ebre wo mayimu. Eno man yemre saa. E wa apomuden hu nsem wo Ghana ha. Ntie eye ho bra Afinyo Markins. Ono so nsama wa kan fa ho. Ono so wadi ya wo parliament. Osi ese abanye bibi fa ho. Osi say we yare hepatitis B ya. There are no any health retroviral drugs e wo ho ma wo. Ebi ni ho. Ja e wo ho no eye HIV/AIDS eno postal ebi no mu ensanka. Enunti yenti ono so asama waka afa ho Honorable Afinyo Markins lamenting about the health service in Ghana, the poor state of Ghana health no pomodeno enkoye yenti no.
According to the minister, government will soon introduce immunization to save lives. But what I find curious is the fact that though hepatitis B affects a chunk of our population, in fact, Mr. Speaker, record from Ghana Health Service gives a data which is in excess of 1 million being infected, yes. And I've had, yes. I made a statement on this on the House floor. They estimate almost 10% of our population infected by hepatitis B. What is quite curious is the fact that the HIV AIDS, we have this antiretroviral, and that is for free. May I know from the minister, in view of the effort being made for the immunization to be free very soon, are there plans by the ministry to also add hepatitis B treatment to the category of HIV AIDS? Because, Mr. Speaker, they all depend on the antiretroviral for treatment. And one effect of this hepatitis B is that it leads to liver cancer, and the deterioration is faster than the most feared HIV AIDS. All over, people are suffering, and it's not only through sex that people get infected. Even sweat alone, the food, yes, food, drink is there. Body contact alone can cause the infection. So, Mr. Speaker, can the minister make that disclosure if there is any such plan?
Yes, Minister.
Thank you, Mr. Speaker. Mr. Speaker, my information is that it is very, very difficult to treat or to cure, if not impossible. But then when you get the symptoms, the National Health Insurance, as we have it at the moment, covers that. And it could be managed. It could be maybe. That is why I'm saying that it is not curable. It's not, its treatment is very difficult as we stand now. And so, Mr. Speaker, having it as symptoms could be considered under the National Health Insurance as we have it at the moment. Yes, so when you have, every disease and its symptoms, you understand. And so, for example, if you go to the hospital and you have headache, and they try to manage the situation. And those situations are under the National Health Insurance as we have it at the moment. But to say we are treating or curing the hepatitis B on the National Health Insurance, that maybe I will have to recheck.
Speaker, with respect, I need to lay a good foundation for my respected colleague, the minister, to understand the situation. Mr. Speaker.
All right, cherished viewers, you are watching Chairman TV, Citizen Vibe. Now, and you show the state of healthcare in Ghana. No, quite make us a poor state of the health condition in Ghana. As a Ghana, Kasano, ya promoting who seminar is getting abysmal. It's not encouraging enough because we tie seman penifo kanya a minority leader and majority leader kana. It's very pathetic. Yeah, say me no ye tax, ye tie sika. You got to be a tax now, so still the health service is not up to scratch. It is so pathetic. It's very bad, very appalling. Now, we share a semi wakana a minority leader of your market. I mean, for also 10%. About 10% of Ghanaians are suffering from hepatitis B. That's from liver cancers, liver cirrhosis, and all that. Say. Yet, or Mamuna BBC, if we don't have the education for it, how many people know that through illegitimate sexual behavior between Yamawenya, say, will be sweat crack, say, Adrian and other things, cry, no, we will be able to media sign. How many people know? Meanwhile, sir, when I duties of the government, people will be not in Yajuman yet. By a mamma, a quite some carbon, health education, I'm a Kaiser, I'm a health education person. Or Eastern region, Yanam, near no for Kasa, near to a mufo. because prevention is better than cure. So you prevent it, yes, since I will change not to a then you try to cure it because you got to spend a lot of money and resources before you can cure. That's why prevention is always better, first hand. Until I say yes, baby, it's painful in the state of it. I mean, also we have to wake up. We have to speak to it. I say the bad behavior of health workers, quack doctors. Hospitals, decry in your hospitals, in one corner, taking advantage of it because Omunim say a buying side no a fairly. Omunim say hospitals, I say yenya agenda 111 no MPP are buying by Omoya your moon to me and fan could be. And this are buying so bad, and I'm saying politics in tea, almost so your margin so you. Almost be see hospitals so pay from the scratch. They come by 1 year or 2 years to election and son or market touch agenda 111. Sanity, but we have to push the government to work. I say a catcher, a president on the money, Mamma Naba and say, there be you, in to me, chance, and 111, a gun of Fusika, Jay Bribin Famu. Tina Citizens 5, Chairman TV, you have to also speak out. We have to show our views. Our displeasure, no my own shadow our health sector. No, I say you to me, a canwasem, na bibia, it to me, you also probably then. What do you think can help mitigate these issues? A health sector na, a Ghana na, a very poor na, and shadow you do my papa na, nipa, a show omo basano. Accident, sia, ansana, yabeka say in your ambulance, rescue team, no, na nipa, by the war crash or mukwa. Because others will be bleeding, others can't breathe. A whole lot of issues. Nipa fa baby man say ba ko do hospital from go do ese bed in you. Na yale for the defam. Eye easy. Nti ese ye ka bibi. E kire aban ese me no ye bibi. Nurse for no doctor for. Ye ndo do ye ho. Na hwini nya na eni enya. Eye wa adwene se nipa na obusuani nti won fa no ho. Eye sa enye yie. Na ye ka about no bed syndrome. Eye owura Emisa Charles Okakofre no kwen just 29 years old man na ye kan ho asem deputy minister Grace Ayesu Dankwa wa ba se obeclear na mesre no manen clear sa o se no be shi na ye se empa na eni nipa no akọ hospitals too wenya afenso ye mate se yeyi nkrofo edi health personnel di yeyi omo edi. Say I'm from Swana. I say Kaban make sure say ambulances our car kwan so. Kwana bia into be a no pia. I think a community bia MPC na etuminya ebi. Na go to me frɛ. So obi a leo na ambulance pay na fa into ye to aba. Yan to aba say mon koda parliament na mo meka dia mo efa healthcare we want the solution to it. TNT Deputy Minister Grace Ayensu nsema okafa ho.
Yeah. So yes, and you hit it right. I mean, I've been at Kolebu and seen people being attended to in wheelchairs in the emergency ward. I've seen people being attended to on beds that they borrowed from ambulances. This happened to my own mother. A bed that we borrowed from an ambulance was what we took to the emergency ward. We didn't even get space in the ward. We were in the corridors until at a point we were moved into a ward, and it was luckily I had a friend who was running a hospital, and so they allowed us to take the bed on the. It doesn't need to get to that, right? And that's why I get to the systemic processes. Now, if there's a protocol for this, and I'm certain, one of the things that we do very well as a people, as a country, is having very good protocols, having very good policies and systems, etc. When it comes to implementation, it's not just in health, and it's not just at the national level. It filters down. We when it gets to implementation, we leave a lot of room for improvement. We need to curb that, right? In a space as delicate as healthcare, we need to curb that. I am certain if we go into the books of the Ministry of Health, the Ghana Health Services, all of the organizations that matter, you find all of these. We need to consolidate. Right, which is what I spoke about first, that we need a consolidated framework that is very simple for everyone to follow, that citizens like me and you are educated on, so that when we find a situation.
You lovely viewers, you just listened from the horse's own mouth, this health personnel from Kolebu Teaching Hospital. The face you saw, that man's face is the deceased person. Ono na yahwe no no. Na nipa nankasa akire say empa eni ho. It's emergency unit na system na hospital enye adwuma sa na waka no. Nti yentie minister nankasa sama ono so eka deputy minister is Ayensu.
Thank you, and thank you to your audience. The ministry has given a lot of thought to it, and we've been working on it for a long time. And unfortunately, this incident happened while we were looking into it, or while we were finding solutions, and we've actually found solutions to the problem. What is the no-bed syndrome? The no-bed syndrome is where people get to the emergency rooms, or they get through to the ambulances, get there, and they say there's no beds available in the hospital. When we say no bed, I believe it means that there is not an available open bed in the hospital. But why would there not be a bed? And I think that is, how did we get here, and what is the way forward? Well, I believe that it is a systemic failure in the entire emergency system. It starts off with pre-hospital care. When the ambulance picks a person, there's a series of things must happen while the ambulance picks the person. In medicine, we have something called the golden hour. The golden hour is the first hour after the trauma happens or the incident happens. That first 60 minutes. Decisions we make in that first 60 minutes will either make or unmake the situation. Decisions we make in that first 60 minutes is what is going to keep the person alive, or the person is not going to be alive based on those decisions. So the first 60 minutes are the critical hour. That's why we call it the golden hour. So for instance, let's talk about the incident in question. The patient is picked up. Once on the field, what happens on the field in the first place? Because we do have pre-hospitals, which is when the patient was found in, I believe, around Circle. What happened when the ambulance got there? Then the ambulance picks the patient. What happens inside the ambulance up to the level of the hospital? Once the patient gets to the hospital, what happens? So it's a series of continuous things that has to be done. In the field, there's a lot of things we can do. We can do CPR. We can stabilize the patient. In the ambulance, there's a lot of things we can do. We can stabilize the patient. We can start IVs. We can put IV fluid on them. Currently, what we do is scoop and run. Scoop and run is we go, we pick up, the ambulance picks up the patient, and basically it is a transportation device that takes the person to the hospital. Elsewhere, ambulances are not just transportation devices. Things have to happen inside the ambulance because, like I said, the golden hour is that first 60 minutes. So the ABCs, which is the airway, the breathing, and the circulation, to make sure that the patient is breathing. The airway is not obstructed. The patient is breathing. The second one is to make sure that the circulatory system is intact, meaning that the person is not bleeding, obvious bleeding. Even if it's internal bleeding, you have to know that this patient's blood pressure is declining rapidly. And so what do? That means that we have to set an IV and start IV lines. Once we get to the hospital, basically in most jurisdictions, you just hand over the patient to the hospital staff. So when they say no bed syndrome, then it's not just an ambulance issue. It is not just a hospital issue. And it might not necessarily even be that there's actually no bed. Because our solution is to have a hospital management and referral integration system that is usually IT run, which is what happens elsewhere. So there's a central place or house or office where somebody sits and looks at has a dashboard of, for instance, each district.
Well, lovely viewers, you are watching Chairman TV, the most credible, reliable, authentic, entertaining, and most informative TV station. A citizen's vibe, and I will share the health, the state of healthcare in Ghana. I just said the poor state of healthcare in Ghana. Ghana ya pomuden we ya ye to na sawram ye na basa no. Deputy Minister for Health Grace Ayensu Dankwa Siro Bibri ya to aba eyu. The rhetoric talking had also be. Yes, you got to work as a president on the money Muhammad because we as professionals. Because come to think of it, what's a system failure? A system by Nipana or use system is human beings who operate that makes systems work. It is a winning say problems our health sector now. 1 year near plus some months still with so air facing the same issues. Until yet, I say we be a home. Not just talking, yeah, fakasano. You people should be up and doing because taxpayers sika and you do amoka. They say we make sure say nipana omo efa eye yale mu aye betumi kura a prevent no amu no. It's one too many. And same fata. And yet it also betumi the wajin shabani hu say kwan ben so na ye fa so aboa na Ghana pomodeni tumi akonkan. Na deputy minister no na wakasa no. The castle can in still complains so will be our power. Na yasan so de edwuma ahye won sa office kesi se ahye won sa. Still IT system na wo de ba be edwuma. Ehia ambulance mana kofa nipa ba wo se IT. Ba cho yentie kumase ambulance commander se ma waka fa ho. Se me jataba na meka wo so tie. Ambulance so se bi ni ho. Nti wo yare a aka wo ne wo yam yentie taba na yeto ne se.
So in such instances, the ambulance is engaged at the hospital. So when there's now a pre-hospital case at the constituency, it becomes difficult. All right, so we think that if the peripheral hospitals are equipped, they are better able to manage some of the cases there so that they don't really burden us with moving the patient from that area to the central point where it's always choked, right? Konfonoke, a lot of times is overwhelmed with a lot of cases. You get there, a good number of people are still waiting for bed, and you get there with your ambulance. Sometimes we spend about a whole day with the ambulance waiting for a case to be handed over to. So you see that.
It is so sad, so what's it from the commander of ambulance services in Kumasi saying the ambulance service in Kumasi is not working well because they have inadequate buses or vehicles to attend to people in time of emergency issues. Actually, say omope car kra kwako afa obi a wa manim say accident and I say yare serious bi na aba kra omuntumi enko because ambulance e bi ni. Nti mami ka say no bed syndrome no have sense say nipa no we fa no free they didn't na ambulance they do go do hospital yes empa na eni o na nipa no care we ayehwe nipa no enu nti na nipa no yes I don't believe it. Yes, I stand to be corrected but ndindi ya mididi say ambulance is available for community BM constituency BM say ambulance be brave wo as so mu chini krum say na buchire tie no so that obi complain say emergency baby ya ne ya na che say you around we tumi afa no ebi no kwatua sika pempem so obi yare ya sika ambulance for tumi general even private ambulances no they charge high fees intini obi tumi ya wontumi na fedi they said for different means of transportation mu intini bi sasa ya check ya na say ya fa obi free baby na de ne akono aban check say ambulance for sika omoje aban check ya na nyinyi ibinum de mana show mu nsem charge fees omope say omobe rescue obi say omobe obi nkwano na say kwa sorry ko bom paye ya ko mosque ekoto ebom paye ya allow akubar nipa dodo na so odo enni ho because ye do ye ho ampara jaise say ye ne say oyonko da no da di honabo ayarga oka say otu kwan na si a wonya accident no hwe how from was in commodity share car boot ti mbisa senti boko central no ambulances ono sorry no wonya nkwa no ambulance do say na wo boko central ho Upper East Horn ambulance do send a war. Not just talking. We respect you, honorables, a lot. So you should be up and doing. yempe sa bad record no health care system because health is wealth. Ya won kwan na ya wade won kwan na utumi koba utumi hwefie. Yare ahodo mpo no nim the way to prevent it. Health education is very poor. Yentumi nanso saa fo nyina ese nka ban tumi fa nkofo nipa dodo na wie school omo nye dwuma ye because wo kan a we research obo we say health sector no aban no su bebre wo because of health insurance no aban boka bebre tondro bebre no your taxpayers money, but if you could use a lot of it to educate people able to me as save a lot of money because health wise no health education. Your time na you 2 years abontere na ya je report about hospital ya kwakopa na ba bekire malaria na ya kire onya obefa so a wonya bi eche mosquito net ye bebre na ese ye se na be ya oman bitumi afa no ntoma pa ifra enti and citizens vibe is about poor healthcare in Ghana. Yes, so this is the state of the healthcare in Ghana. So the politicians should stop the rhetoric. Kasana does be brave. Yabaya, no one yaman share NDC abine, one yaman share, President Jaman, Mamma, one wapa, one yaman share, that for Abama. Mokwani, Jenny Beashi, Mumuni, way is here. At then, and I am fire 9 NC from the Yadia in San Fata. We should do the needful to save our citizens. Nti yen twen say abatuo du a na ye baba yesi yesi hospital na ye twa sword na ye yesi you say ya this time yes say ye we ya mo yare ye dem tu ye fa plane fa na ye dem kwa abruchire no ye dem kwa abruchire say kwa kosa mo yade ye enim say President John Mahama wo ba no be see University of Ghana Medical Center we see ye Rich Hospital we see ye Tafo Hospital they be assigned name the same thing. You intubate me after 0543736700. Also share what you say, Kwan Ben so near far Ghana, your healthcare, and I say, I promise you, able to me a conquer Amayan. Also call and show us how or what are your problems in your locality about the state of healthcare in Ghana. To also be me after everyone is listening to Chairman TV. Chairman TV, the international TV station, na mabuche baby Europe, Dubai, Nigeria, Africa, many countries, and I feel so Ghana. Ti baby will be also with Ukasa, Ubia, Ebiti, Hano BIT, the most credible, reliable, and authentic, entertaining, and most informative TV station. Until a citizen's vibe, and I will share with Chairman TV. That's what YouTube, Chairman TV GH, and Facebook, Tony Serious. Also so cardiovascular diseases and many other diseases that can be cured no a young way 200 more saying a young citizens no and I yen to mean push politicians no for politicians by your personal what do we ask omobe ye no ma be yisika to obi pon no ma be yisika to ahemfo no ne bisasa ye to me etnase I can say, oh, MP, what by area ha, and never you know what I can't upon the one same. The hospitals say what around no. And ye Juma, ye to me who are more responsible at night. It's high time, some pollution about area, and say what me trans no one come as him. Say upon the one same and conquering. Until ye be and found Yama and no here. By a ya says sometimes we share politician or two bottom no money panel fights nothing is panel with Najina with the asa. No, away and that's when you're accidental. Ambulance being you, I do could do hospital quiet and pen you I had over Tosso. It's a pomodino and who here. So we should focus on it. Because we need a pomodino. If you are not healthy, you cannot do anything meaningful. Because we are here, won't me cancers, a lot of dangerous diseases, able to me eradicating simply, but because of negligence on the side of health workers and a young citizens, we don't hold them accountable. Nina ekahubi. Nti yan yeri yahu asofo en kasa ɛyɛ yare nyinaa na ɛyɛ mpaebɔ yare bi wɔ ha ɔkase esi kwan yie wahwɛ hepatitis B wei obi yare ɛbɛka sɛ obi ato ne duro na nkurɔfoɔ ka nkurɔfoɔ kɔm na nkurɔfoɔ nanso you can get it obi sweat ka wa wonu obi edi aduane bi a na so obi a ɛbɛtumi aka cases sex many other things ɛbɛtumi ɛde aba nipa dodoɔ sɛn n'ani we have a lot of diseases a ɛyɛ wa ɛnam sɛ public education on health na very poor ne nti no na ntakwa esi fie obi ato obi eduro na so mesi no ebeyifo na so mesi na asɔfo bi gyi scan bi gu omo botom na nkurɔfoɔ wuhu because of poor health service and our conduct towards healthcare no yɛnhyɛ daa ɛyɛ serious wɔ ho nti obi tumi wu at once na ɛsɛ yɛde agye no nso woboa yɛmfa ngye no yɛ wobɛkɔ no na yɛ health issue bi anka yɛbɛtumi asɔ ho but yɛbu yɛni egu so yɛyi yɛni ɛna yɛbi bi spiritual bibi anyɛ spiritual a lot of things no ɛyɛ physical things nduane a yɛdi ɛna montu a yɛtu saa nneɛma nyinaa na ɛsɛ yɛ taking serious na yɛapɔmuden ɛbɛtumi akɔnkan because a healthy nation is a wealthy nation. The number is 0543736700. Also, betumi afrɛ na also de wadinche aba fefefe. Nti ene ye discuss about the state of healthcare in Ghana. Umpeswa so etisen. Umpeswa so enkomo no etisen ewo ho. Enkwada omo eyare treatment ben ene edu omo fam. Treatment ben bed ni ho obi oyare na esan de na atifam obeso kwa no we pneumonia ohomia ensisi so nya ensisi so emergency case ba na bi no kire omo ho diso hu se sika wo ho ansa na warahye wa ba bagye saa so ba tantan nyina se yegya wo man no na ma onyado etena na kyese yenim nyame o. Say attitude towards the sick, towards the poor. Say yes, sympathetic enough. It doesn't reveal any true Christian life in us and any Islam life in us and patriotic life in us. And what? So we should hold everyone accountable to President on the man, Mama Bob, who persuade him for not paying for opinion leaders, stakeholders, Mr. Monka. Say, how say any ye feesi, ewa hasi, health wise, so, Mumway and found. Into me more monabia into me and Kosuye. Now, I had a marriage imagine in Abyssinia, I'm not the more china. Ida mpanache anase awale ni nyina ewo homa nti kachi obi se chairman TV eye program say anadwi na wo sutem kechire ene squad ni na beba betenase Unimix edible foods also osha one corner e wo jemfu akọ daban new side manjaro mu nyina atwatwa nti aha na edudwumi aduane bi di midinde jataba oman de gbofo kotebeka number 1 sami kwatia na mebeka nfafefe dedede sami fuma mfanche ebesan asia you. I love you so much. Keep watching Chairman TV. Ubetumi so ede eye wo promotion business be aba me promote ama discount no low with me afre number na that was screen use 0543 736 and afi Chairman Media Institute. Yes, hano professional journalist ewo and a professional journalist ewo international journalist of course kase bia bi so person who akwan ya fa so de camera itwade mane bi me dem korjin professional camera for and omusua ifri professional editors and omusua ifri nti da person we media work no bia no person kasa we so tina jataba me ya a Chairman Media Institute adawuma also fa wo babra na wan kasa person ba act of communication be very effective e bia wo betumi agina akasa kire ni bia person mo kasa bia wo betumi nti ma onan embo woto nti ye besan ehia me adoma ochena same time 4 o'clock 5 besan ehia bio bye bye.
You gotta get up, you gotta